Hello everyone, this is Sagar Mode. I am an intern in JJ Hospital, Mumbai, and I completed most of my internship, and then I took a 3 months of extension. I went to the US and did three rotations over there. So the first rotation that I did was with Dr. Atut in Hackensack Hospital, and over there we were like rounding in hospital as well as we were doing the inpatients as well, inpatient and outpatient both. That is a like mixed rotation. So overall, like main difference between inpatient and outpatient is like for inpatient rotation, you just go to the hospital and round with the attending. So like the basically you have to be on time on for inpatient rotation because like if you miss the attending and the attending goes on rounds, then you are done because you cannot call the attending and ask where are you and which floor are you or which patient are you on. So like you have to be definitely on time. For outpatient, you have to be on time, but like it is more strict for inpatient that you have to be on time. Then like in the benefit of inpatient rotation is like the LOR is obviously more valuable compared to outpatient, but inpatient rotation you are in very close contact with the residents, so like you can network well with them, and like if you have a good rapport with every one of them, and like you can ask for tips like how did you apply and what did you write in your CV or what did you write in your SOP or something. So like inpatient, this is I think the most benefiting thing. Like you are in very close contact with the residents and you get a proper idea of what you will be actually doing when you are a resident. So that is the biggest difference in outpatient and inpatient. But on the other hand, outpatient rotations usually give you a very hands-on experience because like the third rotation that I did was outpatient with Dr. Killen in Brooklyn. So where we used to do like we used to call the patient in and then write all the SOAP notes, as Aditya mentioned very well, like subjective, objective, assessment, and plan. Like basically, subjective is what the patient tells you. For example, if a patient tells you that I had a fall while walking up the subway stairs, so you just put in like the patient complains of a fall while walking up the stairs, and you ask them further questions like did you feel any dizziness or like was it a physical just a fall like a mechanical fall or something. So you just put all of these things in subjective. Objective is basically lab reports and the imaging that happens, and then you can for the assessment is like actually assessment is the comment that you give as a doctor. Like for example, if I'm seeing an anemic patient and his or her hemoglobin was I think 9, and then after like 3 or 4 weeks of treatment, like that patient comes to you and you see the hemoglobin levels of 11, so you just put like hemoglobin levels have changed from this to this on this date. So this shows that the treatment of anemia is going on well and the patient is benefiting from the treatment. So this is basically what is happening with the patient, and you as a doctor have what comment do you have on the patient. So this is assessment, and plan is basically the treatment that we give. So because this soap system is kind of new for us, like for Indians actually, because we don't use the soap system over here. So basically, you need to get very like if you're equipped with the soap system, and actually once you start using it and get used to it, you will think that you'll feel that soap system is really good because it like helps a lot in like assessment and plan of the patient. So basically that. My second rotation was in St. Mary's Hospital. Dr. Nader Mahmood. Actually, he's a pulmonologist, and that was a really nice experience because over there I got to like make like they made an account for me on their EMR system in my name, and the EMR system that hospital uses is Epic, and the one that Dr. Killen uses is the Practice Fusion. So both of these EMRs are really good. Some EMRs are like as someone mentioned that like sometimes it is difficult to get used to the EMR system because some EMR systems are like very complex. But I did not have any problem with using Epic and Practice Fusion at all because those were like I think very easily navigating through. And basically, inpatient you wear scrubs and outpatient you wear like white coats with formals. So basically, there's a difference. If you have any questions, I will be happy to answer them.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.